Washington was also at the forefront in health care in 2013. The landmark Affordable Care Act, which is aimed at reforming the health care industry, started its rollout but got off to a rocky start, to say the least. Bertha Coombs has been covering it for us since the start. Well, what a memorable year this has been in healthcare, Bertha. So we have this rollout, but it really started off on the wrong foot. What went wrong?
It was spectacularly bad. You know, we had gotten warnings that there would be some glitches, and that became the word du jour for several weeks. But clearly what happened here is essentially they were trying to build a giant building without a foreman, without a project manager. The health department was trying to be the project manager on its own and really did not understand the scope of this and was not able to knit together all the various contractors, and the key contractor in the middle, CGI, clearly it seems was not up to the task of really bringing all these pieces together. Everyone said it was a complicated process, but clearly they underestimated just how complicated it was.
I remember sitting here with you in late September and saying a lot has to go right. It seems like almost nothing did.
Almost nothing did, pretty much. I mean, essentially, initially the problem was the front door. People just couldn't get into the system. Now we have to talk about the problems on the back door, the back end, the processing of those applications, the processing of the payments with the insurers, making all of that infrastructure works well. Last week, they named Kurt Del Bene. He is a former Microsoft Office executive. So he brings both the engineering chops and the management chops, because there's still a lot to do to get the whole thing seamless.
So do you think it can recover from this whole mess?
I think it's really going to impact enrollment. I think all of the bad headlines, even in the states where it's working relatively well, people have been a bit reticent to go on because they just saw all of the problems that went on. So the administration had initially targeted some 3 million people being enrolled by New Year's Eve, by the start of coverage.
We're not even
January
close.
1st. We're not going to be anywhere near that.
This was supposed to cover the 40-some million people who are uninsured.
Right.
And as of late December, how many people have signed up for coverage?
We have seen, as of late December, looks like we were probably in the range of 500, 600,000 in terms of people who are in paid plans, and then another maybe million or so in terms of Medicaid enrollment. We don't know how much of that is Medicaid expansion, which is part of the Affordable Care Act. There may also be some folks who, as they say, sort of have come out of the woodwork, knowing that it's time to sign up. They may have been eligible all along, but now they're signing up. So the Medicaid is going better than the paid enrollments, but the paid enrollment is really the key to this, because that's where you really need to expand the risk pool. And if young people stay away and wait for a long time to sign up, it really makes a much more difficult market for the insurers and for the program itself.
Obviously, lots of issues, a lot of problem spots, but going into 2014, what's the key thing you're going to be watching for in healthcare?
I think the key thing we're going to watch is to see what kind of mix we get in terms of the enrollment. Clearly, you're not going to get the huge numbers, but what's even more important then, because it's a smaller pool, is that you have a wide and diverse group. Again, that you have the healthier people signing up, not just the people who are going to use it a lot. And then just seeing how this issue of the narrow networks and people starting to use insurance, people who have been putting things off for a long time, pent-up demand for services, how that's going to impact costs as well. The insurers are not really going to have an awful lot of data by the time they have to start figuring out what they want to do about premiums for 2015.
Yeah, you're going to be busy covering this story, and we're going to be counting on you to keep us updated. Thank you so much. Bertha Coombs on Healthcare with us.